Hello. Today we're going to talk about the second part of the lecture about basic principles of homeopathy, scales of homeopathic delusions, constitutional types, theory of miasms, and Herring's law of healing. The plan includes three parts: constitutional types, Herring's law of healing, and the miasms theory. Their constitution is an innate and acquired mental and somatic organization of a person. The constitution is manifested in the structure of the body, psychophysical behavior, and temperament. This is a result of heredity. A homeopathic physician prescribes treatment for patients on the constitutional basis. That is why it is very important for the doctor, firstly, to figure out the constitutional type of the patient, and only based on that, the person can receive from the doctor a good treatment. Constitutional types are groups of people who react more strongly to a certain drug in an early, even preclinical stages of the disease, after an acute episode, as well as in chronic diseases. This definition was given by American homeopathic physician named James Tyler Kant, and this definition is still working, and this is what are we going to use. People respond to homeopathic medicines at varying levels of intensity. Some people respond particularly well to one of the medications. People in this unique group seem to have similar physical and mental characteristics. For example, we can talk about the quality of the skin. Those one that we talk can be oily skin or dry skin. We can talk about hair color, natural, of course, and also the type, thick hair or thin hair, some specific curly hair or straight hair, and also, of course, height and weight of people. In the future, these people often suffer from similar diseases. Basically, for example, when we talk about ginger person with very fair skin, usually they are very sensitive to specific groups of medicines. And the other group of people with dark hair, with darker skin, with dark eyes, brown eyes, they respond severely to the other group of medicines. So from on the one hand, when we group people by their constitutional types this way, sometimes it may sound a little bit offensive because we divide people based on their appearance. On the other hand, it's not about offending people. It's about finding similar traits that will help the physician, the homeopathian physician, to predict their possible response on different medications, and it really works. So it's not offensive at all. It is all about science, and it is all about how to group people into different constitutional types so that we can provide a patient with the best and the most appropriate treatment. Parallels can often be drawn between certain characteristics of people in this group and the physical and chemical properties of the drug. Each constitutional type described in homeopathy has a specific constitutional remedy. We have general remedies, general medicines suitable for most of people, like for all people, let us say it this way. And we have medicines that are very specific for a certain constitutional type. Of course, we are pharmacists. We're not talking about prescribing anything to a person, but we need to understand the principle to prepare the medicine good, because sometimes you may get a prescription with some extra marks from the doctor, and just we need to understand why did he decided to do this or that. This is because of these specific features. Every medicine in homeopathy has a specific state of consciousness that is unique to it, just as every patient has its own individual state of health. And if the homeopathic physician selects a remedy that matches the patient's mental and emotional symptoms, the body's vitality restores its original course. Thus, in the homeopathic method of treatment, a drug is selected not for the treatment of a specific disease, unlike traditional homeopathic allopathic medicines, but for each individual patient. A drug is individually found that is able to restore the vitality of the body as a whole, so that later the body can cope with pathologies on its own. This is the main principle of homeopathy. We need to boost the self-treatment, self-healing process. The division of people into constitutional types, depending on different sensitivity to drugs, was proposed by the German homeopath Hahnemann and formed the basics of homeopathic medicines. And again, we talk about Samuel Hahnemann. Of course, Hahnemann, being the founder of homeopathy, he really gave lots of theories. He made basics for many future theories that was later defined by his students and his the other homeopathians, but lots, if not the most, of homeopathical treatment principles, of course, was given by Hahnemann, including division of people into constitutional types. In his times of his living, he only had the possibility to divide people by their appearance. No other options were available in that period of time. Now we have more options. We have different tests for people, and in his period of living, only appearance could help him. Constitutional medicine is a medicinal substance that includes the entire sum of signs of the physical, emotional, and mental state of a patient of a certain constitutional type. Constitutional prescription method. In order to establish this constitutional remedy, the doctor must record not only the painful symptoms, not only describe the pathology, but also the appearance and behavioral characteristics of the patient in a state of complete health. That is why I stress your attention once more. The good doctor, homeopathical doctor, talks to the patient for a couple of hours. He talks to his patients not only when they need them, when they are ill with some disease, but also he tries to talk to them when they are healthy. A good homeopathical physician has some kind of a journal with little jot downs, with little notes about his patients. So he knows their constitutional types. For example, whether the person is very calm and this person is an introvert, or opposite, the person is very emotional, and what kind of emotions are for that person, whether the person cries a lot, or the person laughs a lot, or the person is angry a lot. All of these can help the physician to choose the correct and good medicine for treatment of these people in case of their illnesses. So he just jot down everything. Inclinations, strengths and weaknesses, traits of character, all about emotional state, everything like that. Further, the homeopathic physician compares the obtained information with the medicine that most closely expresses the patient's integrity. The 15 constitutional remedies are the most commonly used, but usually all polycrests. You can see them on your screen right now. Arsenicum album, Bryonia, Calcarella carbonica, Carba vegetabilis, graphites, Ignatia, Lachesis, Lycopodium, Natrum muriaticum, Nux vomica, Phosphorus, Pulsatilla, Sepia, Silicia и sulfur. Let's talk about sulfur, homeopathic portrait of sulfur. It's interesting because such people as Albert Einstein, Honore de Balzac, Dmitry Ivanovich Mendeleev, they belong to the same constitutional type, sulfur. So let's figure out what is that. So many people, genius people, are in this group. The nature of sulfur constitutional type is multi-faced. They are usually thin, poor in correct posture, may look unkempt. Hair is coarse and dry usually. The skin and lips are prone to rednesses. A critical look on things. So mental abilities and traits are also very important in constitutional types, and for them, of course, so they have critical look at things, inhibited thinking. They love to argue. Such people love to argue because they, not because they don't like the other people, but because, first of all, they love to learn something new. And when they are sure about something, they are ready to fight for this idea and they are ready to prove their thoughts. They lack willpower and self-esteem sometimes. So they can be genius, but they can be lazy at the same time. Or they can be genius, they can be hardworking, but they can lack self-esteem, so they may think that they're not good enough. So they are quite critical, they have self-criticism, critical to themselves. Often unable to complete ideas or projects. This is a very good characteristics. Such people can be brilliant in giving ideas, but they at some period of time can become lazy in implementing these ideas into life. That is why those people usually have some assistance in their life. They generate ideas, start working over it, and then when they are not interested in it anymore, then the assistant helps them to come up to the end to get the good result. They may have the potential for intellectual creativity a lot. Geniuses belong precisely to this type. That is, all of the greatest scientific minds and greatest philosophers of all times and peoples, from Socrates to Einstein, had the sulfur constitution. The same can be said of all great composers. If we analyze the closer to their look, most of them look like the same, like not so good skin, not so good hair, not so good physical activity, because they are always working a lot mentally. Let us say it this way. Sulfur's mind has a tendency to dive deeply into what interested them, right down to a holistic and thorough understanding of the subject. So they try to understand the subject maximally deep. At the same time, people of this type have often received a little formal education and they are self-taught. This is because usually they feel boring. They are bored in the traditional school. They feel themselves not in their place at the traditional school. And because of that, other people around them may think that they are not very good at studies, not very good at education because they have bad marks, but not because they don't understand the subject, but because they feel bored there and they don't want to pay too much attention to classical school. Such people, they can be, for example, super interested in physics and absolutely pay not a single attention to chemistry and opposite. It's just the sulfur people have developed a gift to grasp the essence of the issue, combined with an amazing work capacity. They, like Mendeleev, Karl Marx, Honoré de Balzac, and Einstein, relatively easily managed to make scientific discoveries, create a new discipline or work of arts. Such people work as a rule at nights and does not take care of themselves and rarely survive the knowledge. These days, it's not so awful for such people because I see that nowadays usually they have assistants that help them to survive, but usually there are lots of very creative people among them, lots of authors, lots of writers among them. They create a lot, and of course, they just don't pay attention to everyday problems, or they just try somehow to find someone who will help them from that side. It's hard with such people in everyday life because they really literally pay attention only to something they find interesting for themselves, they find important for themselves. And when we talk about health, usually such people don't pay attention to their health until the last minute because they are too busy creating something new, discovering something new, and some daily routine is very boring for them, so they are just not very good patients from this point of view. Algorithm for treatment of acute and chronic diseases. Treatment of acute diseases includes low and medium potency drugs. Treatment of chronic diseases includes medium, high, and ultra high potency drugs. You remember that the higher is the dilution, the higher is the potency of drugs. Homeopathic medicines are used half an hour before meals and half an hour after meals. So we do not usually use them together with meals. Dose in homeopathic practice means the number of drops, grains, or tablets. The choice of drug dose is determined by the patient's conditions, including the constitutional type of the patient. Reactivation process. This is the goal of homeopathic treatment, that is, to guide the body along the same steps along which its chronic condition developed in the opposite direction. This is the principle of treatment of chronic diseases. This is when we try to make their opposite direction to get back to the reasons of the chronic disease, put it into the acute disease, and then to get rid of it. Wake up a sick cell that has fallen into drowsy state as a result of an illness and force it to become healthy again. There is a reverse development of the disease. The symptoms of an acute illness that preceded chronically return. Drugs exacerbation. The patient can experience a certain relief already within first hours or even seconds after taking a homeopathic remedy. But the true cure itself can be achieved only after many months, sometimes years. Now we talk about chronic diseases, of course. If we talk about acute diseases, then you remember that firstly we have the period when symptoms become more acute, more severe, and after that we have the healing process. In chronic diseases, it's a little bit different. For a patient with a chronic disease, recovery is possible no earlier than within 1.5 or 2 years. This is what Samuel Hahnemann believed in. And actually, he was right. Because when we talk about chronic diseases, firstly, we need to stop the disease. Then we need to force the disease to move backwards, to go to the acute state. Then we need to treat the acute state and fix this condition for a patient. Now, theory of miasms. I think that you all have heard the word miasm, meaning something not very pleasant, meaning some unpleasant smell or something like that. But what is a miasm? Miasm is a term that comes from homeopathy. Miasm means blockage of distortion of the normal flow of energy in the body's self-regulation mechanisms, causing a predisposition to long-term disease. This is what is a miasm. It's not the smell. It's not some kind of a condition. It's blockage of normal flow of energy. Miasms are divided into acute and chronic. Acute miasms, these are acute infection diseases like chickenpox, mumps, flu, and others. Chronic miasms, these are constantly and steadily progressive diseases that the human body is not capable to overcome on its own. Even if you maintain a healthy lifestyle, follow a diet, and use various methods of therapy, their chronic disease may happen. And our task in here is to get rid of it, to make it backwards and heal the organism fully. What is the term miasmatic and miasmatic concept? What are they and what do they mean? Miasmatic means a part of homeopathical science that studies and describes the sequential evolution of symptoms in the development of a chronic disease like chronic miasm, the peculiarities of diagnosis and treatment of patients suffering from chronic diseases. Miasmatic concept, this is the concept of the development of a chronic disease founded by Hahnemann. The miasmatic approach helps to determine the prognosis of the disease, to choose the most similar homeopathic remedy. According to Hahnemann, classic chronic miasms can be divided into luetic, psychotic, and psoric. Luetic is a destruction miasm. It's something that destroys, for example, skin ulcers. Presumably, it was based on syphilis in that times that was called Leas. And from out of that time, you remember Hahnemann lived many years ago. In that time, people who suffered from syphilis, they had lots of problems with skin, and basically their skin looked so full with lots of wounds, with lots of ulcers on their skin. And destruction miasm, this is called luetic because of that. Psychotic. Ecstase miasm. This is proliferative skin changes. Presumably, it was based on gonorrhea. There are lots of infections in the skin with skin changes, but it's not ulcers, it's lots of infections, and that is why it is called psychotic. So the same from gonorrhea. And the last one, psoric, miasm of deficiency. Scabies, eczema, scratches, seborrhea. This is presumably based on scabies, psora. That is why it's called psoric. And coming from what you can hear and see, luetic, psychotic, and psoric miasms, they are described through their state of skin. That is why in that period of time, Hahnemann, when people didn't get good treatment in that days, and if they had any of these diseases, syphilis or gonorrhea or psoriasis, scabies, they really suffered a lot and they had absolutely awful state of their skin. But skin, this is something we can see, and they also had lots of problems with their health inside of their body. And of course, most of them, they had very awful smell. Maybe because of that, still lots of people who don't know what is homeopathy think that miasm, this is unpleasant smell. No, miasm, this is what you can see right on your screen. This is there are problems with energetic flow in the patient, but due to these characteristics and due to this classification, they are quite often confused with the smell. But first of all, we talk about their state of skin, how it looks like, and how we divide different types of miasms. Homeopaths consider miasms as a type of response in the development of pathology. Each response option, miasm, has a certain correspondence in the clinical characteristics of a homeopathic remedy, which is taken into account by a homeopathic physician when prescribing treatment. Weak response, psoriasm, hyperreactivity is characterized by vivid clinical symptoms, protracted course of the disease, and the tendency to chronicity. The response is weak, it means we do something wrong, and the acute disease may become a chronic one. The patient is taciturn, fearful, the complaints are scanty, hypertrophy is morphologically characteristics. This change is characteristics of their pathogenetics of such homeopathic remedies as calcium carbonicum, sulfur, and so on. Overreaction or psychosis miasm, here hyperreactivity, so the opposite to the previous one, is characterized by vivid clinical symptoms, mental manifestations, a tendency to allergic inflammatory manifestations, the appearance of warts, papillomas, condylomas, and other skin neoplasms. The psychotic type of response is characteristics of the pathogenesis of such homeopathic remedies as tuya, staphysagria, and belladonna. And the last one, distorted response or syphilis miasm, is characterized by complicated development and course of pathology with a tendency to destruction, ulceration, atrophy, severe dysfunction. The patient is prone to nervous excitement, irritation, aggression. We find this type of reaction in their preparations of mercury and gold, aurum. When we move to the next question, Haring's law of healing. It's very important to understand the Constantine Haring law of healing so that we can evaluate if the process of healing goes right or the process of healing goes wrong and we need to do somehow. Constantine Haring was a doctor, a follower of Samuel Hahnemann, and founder of homeopathy on the territory of the United States of America. He has done a lot. He translated and he used the books of Hahnemann. He also founded the homeopathical pharmacopoeia that is still used, like on the basis of which they have this pharmacopoeia used on territory of the United States. And he has done also a lot. He was a great doctor and a great scientist. Arendt studied medicine at the University of Leipzig in Germany, where his interest in homeopathy began. So he was studying in Germany, and there, of course, he had found out about homeopathy of Hahnemann. And after that, like he decided to implement this way of treating into his own practice. He was invited to write a book refining homeopathy, but after reading the works of Hahnemann and studying the clinical statements of homeopathy, he became convinced of its effectiveness, tracked down the author, and became his personal friend and sincere follower. So that is quite interesting. He was asked to prove that homeopathy is not a science, but after talking to Hahnemann and getting all the evidence, he became one of the best homeopathian physicians. In 1843, he founded a homeopathic school, the first in the United States. In the period from 1845 to 1869, he worked in the departments of the Institutes of Medicine and Materia Medica in Philadelphia College of Homeopathy, devoted a lot of research to drugs for snake bites and hydrophobia. His saying is, if we ever fall away, depart from Hahnemann's methods, homeopathy will become just a caricature in the history of medicine. He believed that the principle of treatment by Samuel Hahnemann must be followed very severely. And this is a very good explanation why we still talk about these principles after so many time left, and they are still working. Because when we talk about allopathical classical treatment, treatment 1843 and treatment in 2025 are absolutely different. And in homeopathy, they always try to be maximally close to the principles of healing by Hahnemann. So, what is a Heron's law? He has done several laws of healing. He described them according to his big experience of treating. The first law says that about the reverse development of the disease. If the treatment is correct, the disease will return to its origins. And foremost cardinal principle of Heron's law says, the first one, healing occurs from top to the bottom, from your head to your feet, from up to down. For example, a skin rash in the course of homeopathical treatment moves from the face to the chest, then to the shoulders, then to the hands, and then it disappears. So it moves from the top to the bottom. The positive dynamics of its movement from the limbs to the chest, head, and face will indicate an unfavorable course of process. So in case if we have a rush on the limbs and it moves to the chest, head, and face, it means the treatment is entirely wrong. It should go in the other direction, from top to bottom. The second principle says that the healing occurs from inside out. For example, pains in the region of the heart are replaced by joint pains. The body, as it were, drives out the disease, like push out of itself. On the contrary, the development of headaches after the cure of dysfunction of menstrual flow is regarded as an unfavorable development of pathology and can be defined as suppressions and withdrawal of the disease into the depths. It's bad. The next principle. The healing process develops starting from the deepest part of the body, mental, emotional, and vital organs, and continues in its outer parts, skin and limbs. The treatment process progresses if the patient experiences relief of emotional symptoms while physical symptoms deteriorate. When the healing process moves to the outer levels, relief of superficial symptoms is also observed. For example, the patient is depressed. He is we start treating his disease, like we try to help his emotional state. And in the process of treatment, he is out of depression, but his skin rushes or he gets a diarrhea. It means that the treatment comes okay. So we move from the deepest parts of the body to the outer parts of the body. Because firstly, he is depressed, then he is okay, but with a rash diarrhea. After that, we treat rash diarrhea, and patient is absolutely healthy, both emotionally, mentally, and physically. The opposite situation, respectively, is not a cure, but a deepening of the pathology. The fourth principle. The cure occurs in the reverse order of the chronology of the onset of symptoms. In other words, in the process of treatment, symptoms and conditions that have been transferred earlier are suppressed by improper treatment may appear and temporarily worsen. For example, uterine fibroids are resolved, but for some time the joint pains that preceded the onset of the development of fibroids are aggravative, often in order to then go away forever. What does it mean? If we are going to treat some skin disease, some acne, then after the beginning of process of healing, firstly the acne becomes very severe with lots of extra rash, but then it just disappears, and the skin becomes good and fair. Convalescence proceeds centrifugal from the center to the periphery. So here is a kind of a scheme of the human body, and we have two main principles out of what we have discussed, that healing comes from top to bottom, from head to limbs, and from inside out, from internal organs to skin. Here is the list of references you may look through to know more about homeopathy. And of course, you may find these references on our Pharmail course, where you can find it. And this was everything I would like to tell you for today. Thank you for your attention.